Welcome to the St. Anthony's Hospital Total Joint Program. We are pleased you have chosen our facility for your total joint replacement surgery. Our goal is to return you to the best of health as soon as possible. We will provide you with information to help you become familiar with the surgical process and hospitalization. We hope it will help answer your questions and reassure you about your total joint surgery. Learning as much as possible beforehand will help you play a more active role in your recovery. St. Anthony's performs approximately 250 total hip and knee replacements each year, utilizing cutting-edge techniques that allow most patients to leave the hospital the same day or the day after surgery. We offer pain management techniques that help minimize the use of pain medication. 92% of our patients are able to return to home from the hospital rather than going to a rehab facility, and our patient satisfaction scores are in the top decile. All of our BayCare hospitals are promoting a healthy lifestyle, and therefore there is no smoking in our facility or on our campus. If you do smoke, this may be a good time to consider quitting. In fact, smoking can increase your risk of complications after surgery and delay healing. If you feel you will need a nicotine patch for your stay, please notify your surgeon. Preparing for your surgery. Due to the recent events with COVID-19, St. Anthony's has taken several precautions to ensure your safety and well-being. All patients coming in for surgery will need to have a COVID test within 3 to 5 days prior to your procedure. Any positive results will require surgery to be rescheduled at a later date. Once the COVID test is complete, you will need to self-isolate and only associate yourself with those in your household. All of our hospital staff and visitors are required to wear masks at all times. Our patients are required to wear a mask while they are being treated by a team member. At this time, one visitor is allowed in the preoperative area and in the same-day recovery unit. If you are transferred to our orthopedic unit for an overnight stay, you may have one visitor between the hours of 1 and 8 p.m. Please be aware that these policies are continually changing to ensure the safety of our patients, staff, and community. No surgical procedure can take place without first taking a good look at your overall health. In order for your surgeon to do his job to the best of his ability, your surgeon needs to know about your medical history. Your surgeon or primary care physician will perform a pre-op physical to ensure that you are healthy enough to undergo surgery. If you have any cardiac history, they may also request for you to see your cardiologist for cardiac clearance. Pre-admission testing, or PAT, is responsible for obtaining your clearances and testing prior to surgery. Part of this may be done over the telephone, where they will review your healthcare directives, medical history, and medications. Please note that you may need to stop taking certain medications, such as blood thinners like aspirin, Coumadin, Plavix, or Xarelto, NSAIDs like ibuprofen, Aleve, or Advil, as well as supplements or vitamins prior to surgery. You can take Tylenol if needed. You will receive special instructions on when these medications need to be stopped. PAT will also contact you to schedule an in-person visit. At that time, they will obtain a COVID test as well as any additional lab work required. You will also be provided with a soap called Dynahex and instructions on how to use it. Please note that it may take 2 visits to assure all testing is done within the required time frame. We advise you to take time before your surgery to prepare your home. This would include removing tripping hazards like throw rugs, preparing meals ahead of time, and moving frequently used items to the countertop for easy access. You can look through the checklist on page 20 in your book for further suggestions. Bringing a few items from home may make your hospital stay more comfortable. The hospital does provide you with toiletries such as a toothbrush and toothpaste, as well as a hospital gown to wear. But you may prefer to bring your toiletries and comfortable clothes from home. If you would like to bring your own clothing, please make sure it's loose fitting and comfortable. Shoes should be closed at the toe and the heel. If you use a CPAP machine at home, please bring it with you on the day of surgery. You may bring your cell phone with you. The hospital does provide free Wi-Fi. You should also bring a credit card or some form of payment to pay for medications upon discharge. Please leave all jewelry and valuables at home, as the hospital is not responsible for lost or stolen items. Also, please leave your medications at home, with the exception of eye drops or inhalers. Now that you have prepared for surgery, let's talk about your hospital stay. Keeping you safe is our top priority. We will regularly ask you to identify yourself by stating your name and birth date and comparing it to your identification armband. The barcode will be scanned on your wristband for medications and procedures. This ensures we provide the right treatment, tests, and medications during your stay with us. One of our goals is to prevent the spread of infection to our patients. Your healthcare team will wash hands with soap and water or use alcohol gel before and after each patient. If you have concerns that your healthcare provider has not washed his or her hands, please speak up and ask them. Your surgeon will order IV antibiotics to be administered before and after surgery. We want to perform the right procedure on the right patient at the correct site every time. We will ask you to be involved in this process by identifying your surgical site and confirming the site that your surgeon marks. The evening before surgery, you will receive a phone call from the hospital with instructions on when to stop eating and drinking prior to your surgery. They will also tell you what time you will need to arrive at the hospital. If your surgery is on a Monday, the hospital will call you on Friday. Upon arrival to the preoperative surgical area, they will check your vital signs and order any additional testing that needs to be done prior to your surgery. An intravenous line or IV will be started. This IV will remain in place through your hospital stay and will be used to administer IV fluids and medications. You will receive antibacterial wipes prior to surgery to ensure your skin is clean. Then you will change into your hospital gown. You will speak with an anesthesiologist or a certified registered nurse anesthetist regarding your health and medical history to determine which type of anesthesia is best for you. This may include general anesthesia, spinal, or a nerve block. A nerve block can help prevent pain even after surgery and can last between 24 to 48 hours. You will then be taken to the operating room. This part typically lasts about 1 to 2 hours. Afterwards, your surgeon will update your family and you will be transferred to the recovery room. PACU, or the recovery room, is where you will stay to wake up from anesthesia. Once your vital signs are stable, we will transfer you either to the same-day surgery area or the orthopedic unit if you are staying overnight. They will also be monitoring your vital signs frequently. After surgery, we will be starting you on oral pain medications as needed. The nursing staff will communicate throughout your stay to ensure your pain is tolerable. After surgery, we will start you off with ice chips and water. Once you are able to tolerate that, we can advance your diet to solid food. We will also be monitoring to make sure you are able to void or urinate after surgery. And lastly, a couple hours after your surgery, we will get you up for your first visit with physical therapy. The goal is to get you up and walking with a walker as soon as it is safe. If there are no complications and if you are scheduled for it, you may be discharged the same day. If you are not planning to leave the same day of surgery, you will stay overnight on 6 North, which is our orthopedic unit. The day after surgery, they will be getting you up to the chair for breakfast. The nursing staff will help you up between 6 to 7 a.m. Breakfast typically arrives by 7:30. You will then be ready to work with physical therapy. Patients who have also had a total hip replacement will also be evaluated by occupational therapy. There is a special device called an incentive spirometer. Nursing will be able to show you how to use that. It's designed to help prevent pneumonia after surgery. You might see a pair of pumps or SCDs placed on your legs. These are to help prevent blood clots while you're in the hospital. When you go home, your surgeon may want you to wear TED hose or compression stockings, and these will be provided if needed. Some patients may have a surgical drain placed near their incision, and this is typically removed before your discharge. Pain management. We will continue to monitor your pain, and we're going to ask for you to help measure it. We will ask you to rate it before and after a dose of pain medication. We use a 0 to 10 point scale. It is important to understand that all surgical pain cannot be taken away, but our goal is to make sure that that pain is at a tolerable level for you. We do use alternate pain modalities. While pain medications may help control some of it, there are other methods as well that might help to reduce inflammation and make you more relaxed and comfortable. Ice is extremely important. We will be giving you an ice wrap after surgery, and these special ice packs actually can be applied to your surgical site 24 hours per day. We're going to ask that you continue to use ice at home because by reducing the swelling, it can help reduce your pain. Physical therapy is a very important part of your recovery, both in the hospital and at home. When the physical therapist comes to see you the first time, they are going to be asking you some questions about your home environment. They will ask you how many stairs you have. Do the stairs have railings? Are they on one side or both sides? If you have a second-story bedroom, you may want to set up a bedroom on the first floor to stay in for the first few days. The physical therapist will also ask you about your bed height and which side of the bed you sleep on. That way they can practice getting in and out of the bed from the side that you are used to getting in and out of at home. Try out some different chairs at home as well to see what is going to be the best place to sit after surgery. It's going to be easier to get in and out of a taller chair. If you have trouble getting up from the toilet, you can get a toilet seat riser or a bedside commode for after surgery. And you will use a walker after surgery for at least the first few weeks. Keep in mind that some older homes might have smaller door frames and hallways, making it difficult for the walker to fit through. If that's the case, please let your therapist know so they can work on techniques for you to use the walker through those narrow doorways. There's a couple key things that physical therapy is really going to work with you on. One are your post-operative exercises and safe walking, transferring in and out of the bed, into the chair, on and off of the toilet, stairs, if you have them at home, they'll make sure that you're able to do those before you leave. We really like to see you up in the chair for all of your meals, just so you get used to how things should be for you at home. We recommend starting your exercises before surgery. This will increase muscle strength and help with walking and range of motion. These are also the same exercises that we will have you doing after surgery, so you'll be ahead of the game. They can be found on pages 24 through 29 in your total hip and knee replacement book. Most of our patients go home with home health care the day after surgery. We will have one of our home health care coordinators visit you while you're in the hospital to ensure all your information is correct and to get your home health care set up. Home care will usually be out the next day to start treatment. You will get about 4 to 6 visits total over a 2-week period of time. The type of walker that you need is specifically a 2-wheeled rolling walker, which means it has 2 wheels in the front, and this is for ease and stability. If you have a walker but it has no wheels, or it has 4 wheels with a seat, please let us know so we can ensure you have the appropriate walker to be safe at home. A bedside commode can be used both at the bedside, but most patients place them over their bathroom toilet, and the height can be adjusted up and down, and then the handles can help you get up and down from the toilet safely. After surgery, you may need some assistive equipment for dressing and activities of daily living. We can order hip kits and reachers in the hospital and also get those delivered to your room. The hip kit contains a sock aid, a dressing stick, a long-handled sponge, a long-handled shoehorn, and a reacher. Occupational therapy will demonstrate use of this equipment. You might also find benefit in elastic shoelaces. That way you don't have to bend over and tie your shoes. You may want to consider a shower chair or a shower bench. This can be helpful to be safe in the shower to prevent slipping, and it can make it easier to wash your lower extremities. The shower chair is typically used in a walk-in shower, and the tub transfer bench on the right here is convenient for a shower with a tub. Half the bench sits in the shower, the other half outside the tub, so you can sit on the bench and scoot over and then swing one leg over the tub at a time. Unfortunately, these two items are typically not covered by insurance and are considered private pay. You can find these items at medical supply stores, Walmart, or your local pharmacy. Now it's time to get ready for discharge. Average length of stay after a total joint replacement is about 1 day. Some of you may need to stay an additional day, depending on your progress. Here are the main goals you need to meet to be discharged. You will need to be able to walk about 150 feet with a walker. You should be able to get in and out of bed with little to no assistance. And your pain should be controlled and tolerable. Your surgeon must then clear you for discharge. Medications for home usually include an anticoagulant, normally aspirin, to prevent blood clots. The most common side effect associated with these are increased risk of bleeding and upset stomach. The majority of patients will also be discharged with narcotic pain medication. The most common side effects of narcotics are constipation, nausea or vomiting, and itching. Due to the fact that narcotics are very constipating, you will be given a stool softener twice a day while in the hospital. We advise that you continue to take stool softeners following your discharge until you are weaned off the narcotics. It is also important to eat a high fiber diet and drink at least 6 8-ounce glasses of water each day. If you have not had a bowel movement 2 to 3 days after leaving the hospital, we have a constipation protocol for you to follow. These instructions will be attached to your discharge instructions, and it has step-by-step instructions for you to follow. Additional medication side effects are located on page 43 of your book. When your nurse is ready to discharge you, he or she will bring in your discharge paperwork. It will contain a list of all of your medications and when you should next take them. It will also have specific instructions for dressing changes and when you can shower. You will also be given this discharge information card. This card will have your surgery information filled out, and it can be used in case you have to go to the emergency room. You would provide this card to the ER physician to inform them of your recent procedure and to contact your surgeon. Please call your surgeon prior to going to the emergency room. Publix Pharmacy is available to deliver any new medications you may need right to your bedside at the hospital. You will need your prescription card if you have one, and a credit card, debit card, or cash to pay for your copay at the time of delivery. So it's good to bring these things with you. There are no refills on these medications, so you will be able to resume service with your regular pharmacy after discharge. You do not have to use this pharmacy, it's just meant to be a convenience for you. After your surgery. After discharge, you will continue your blood thinning medications for 10 to 60 days, depending on your surgeon's instructions. Once you've completed the prescription, you are done with the medication. You do not have to call for a refill. Follow-up appointments are typically anywhere between 2 to 4 weeks after discharge. At this time, you can discuss with your surgeon when you will be able to return to driving. You will not be able to drive until you have good control over your operative leg and are no longer taking narcotic pain medications. Additionally, you'll need to inform any of your doctors, future doctors or dentists of the procedure you had done of your total joint replacement. You will need to take an oral antibiotic 1 hour prior to any dental work, podiatry procedure, or surgery. And your surgeon will also ask that you refrain from any routine dental work for about 12 weeks. Infection prevention is extremely important and it continues at home. Make sure you have clean sheets, that you wash your hands frequently, especially when you're touching the incision or dealing with the dressing change. Don't let pets lay on your bed or on your lap while you're recovering. And once you are discharged, the hospital will be sending you a few things. One will provide a link to your online patient portal. They will send this to your email if it's available, and this will allow you to access your medical records. And you may receive a survey in the mail asking about the care you received while you were recovering. And I would hope that you would please take a few minutes to fill this out. In order for us to always provide our patients with the highest quality care, we need your feedback. And that's it. Our total joint replacement team wants to ease your joint pain and help you regain your independence. Following the instructions in your book will help ensure you heal as quickly as possible. If you have any questions, please contact your care team. My name is Amanda Wisniak. I am the orthopedic nurse navigator for St. Anthony's Hospital, and my job is to help coordinate your care and guide you and your family through the surgical process. We want to assure that you have a positive experience. My contact information is located here and should also be found attached to your total joint book. Please feel free to contact me before or even after surgery if you have any questions. Thank you for taking the time to watch this presentation, and we look forward to seeing you soon.